7-year grant. We're in year 5 right now, and it's called Healthy Lives, Healthy Futures. And the role of this grant is to reduce the risk of chronic disease in lower income communities. We're primarily working in African American communities to double the risk of many of the chronic diseases, but we are in Cabarrus, Mecklenburg, and Rowan County. And the main goal with that grant is we're training folks in churches to teach exercise classes to make a more sustainable fitness environment, but we also teach nutrition classes. So Greg is actually back there if you want to raise your hand so they can see who you are. Greg and I work really closely together on that grant, and we teach the nutrition classes. So we're training people in the churches to teach exercise, but him and I will teach the nutrition piece. And one of the things that we've learned from going through this grant is that I remember I called him probably in the second year we were working together, and I said, I just want to get people to open up a can in their kitchen because most people are not preparing food. So when I think about that movie and how that ties into my grant, it really was solidifying for me that we're doing a really important thing here by teaching people how to cook, because it's a scary thing if you don't even know how to use the knife. So we really are putting a large piece of our time into teaching people how to prepare foods. So that is our grant. It's wonderful. There's 24 churches right now. So there's a lot of folks in our community learning how to prepare healthy food, which is great. And I will say, too, that I actually went home, and my husband and I and Greg, I had a team initiative here that we would all practice eating off that amount to see if we could do it or not. And my husband and I did it off 75 comfortably. Now, would I do it off 50 comfortably? It would be a real struggle, but there's things that you can do, and one of those things that I'm doing now with my home is I'm growing some of my own food. So I'm supporting the research campus at their farmers market and other farmers markets in the area, but you know, having your own food and access to your own food can save significantly. Yeah, so we actually have a church in Charlotte that is going to be having a community garden, and the food that they're going to be growing in that community garden will be used in their community kitchen. So something we'll be doing down the road there is also training the people in that kitchen how to cook more effectively and not waste food. So if they have a whole batch of zucchini, we can puree that zucchini and freeze it so that they won't waste it if they don't use it all. So lots of great stuff.
Brandon Newsome, so raise your hand, is the health promotions nurse working out of the Kannapolis YMCA, and he and I are going to start in April a program called Building Blocks. That is a parent-centered program, but it's basically about giving parents the tools to prepare and provide healthy, nourishing meals for their children. So it's not necessarily specifically for children who are overweight or obese, but it's just to help families as a whole become healthier. So that will be taking place at the Kannapolis branch of the YMCA, and we are hoping to get information out through all different venues so that people are aware of that, and it's a grant-funded program too, so there's no cost to participate.